300,000 Australians aged from 16 to 24 are grappling with drug or alcohol disorders, and a quarter of them have mental health problems as well. With such alarming statistics, authorities are keen to make sure at-risk youth are getting the help they need. A report launched today hails one farm program that's being held up as an example of how to turn young lives around. Natasha Johnson reports.
To a beautiful place in the New South Wales Southern Highlands come youths whose lives have been anything but.
At the age of 13 I started smoking cannabis. I was using intravenous drugs like speed, shooting up pills. I was just taking prescription medication. Every time I drank, I was binge drinking. I would at least drink at least a whole bottle or even more to myself.
Matt Giles is 19. His teens have been mostly an alcohol and drug-addled haze, which led to brushes with the law and deep depression. Last October, he sank so low, he tried to kill himself.
I was feeling really depressed. I felt like my whole life had no meaning. I did not have nothing to show for it. I felt like I shouldn't be here.
After leaving a psychiatric hospital, Matt Giles ended up here at Triple Care Farm.
Good on you. You're doing a great job.
A country haven for troubled youth run by the charity Mission Australia that's been operating for 20 years.
The young people we see are pretty desperate. They have histories of family breakdown, of sexual abuse, of drug and alcohol and mental illness.
And it should crack.
75% have both a substance abuse and mental health problem. Some are so impaired they need to learn basic living skills like how to cook a meal or even simple hygiene.
And what about showering and brushing your teeth?
Brush your teeth
every day, twice a day instead of once a day.
During an intensive 3-month residential rehab, they learn how to look after themselves, get some vocational education or training, and work with a coordinated team of specialists to kick their habit and recover their mind.
How are you doing? Thinking about relapse?
If I do get urges, I'm going to try and use the urge surfing technique. It makes everything a whole lot easier. You don't have to travel far to see someone else about something. They all talk to each other how to help me.
Come on.
An internal evaluation of Triple Care Farm has found that a significant number of its young people reduced their drug and alcohol use, were engaged in study or work, and enjoyed improved mental health 6 months after leaving.
He's got a haircut. He's a better haircut than you've got, ain't
No, it's not better than mine. My haircut's awesome.
We're ecstatic with the results that we're achieving.
But what's worrying them is the number of young people who don't get help. Triple Care Farm accommodates 110 people annually, but says last year it received 6,000 inquiries from across Australia.
A day wouldn't go by that I don't end up with a phone call from some mother who is crying on the phone because they are so worried that the young one is going to commit suicide and that they just cannot get anybody to treat the person.
The vast majority of young people get no help whatsoever.
There are 314,000 people aged 16 to 24 with a substance abuse disorder, and a quarter of them, about 72,000, also have a mental disorder. Youth mental health expert Professor Pat McGorry launched Triple Care Farm's report and says that nationally mental health and drug and alcohol services are generally overstretched and tend to operate independently.
They're puny systems, you know, in terms of the level of unmet need, and they're fragmented and are not properly integrated on the ground.
So what does that mean for young people?
Young people continuously fall through the cracks, and often they're told you need to go to detox, you need to get your drug and alcohol issue sorted before we can address your mental health.
I'll do homework too.
Yeah. I think the two things are very interrelated. It doesn't make any sense at all to separate out the the healthcare systems for one from the other.
You lose them when they then have to go to another clinical service.
People can work through the different modules.
The National Drug and Alcohol Research Centre is currently developing a world-first internet treatment to catch those slipping through the net, and 2 years ago wrote national guidelines for counsellors who often feel ill-equipped to deal with both problems at the same time.
The government systems that deal with mental health and deal with drug and alcohol need to talk to each other more.
And they don't?
They don't as much as they need to.
Professor McGorry says the federal government has put serious money on the table, $197 million in the last budget for Headspace centres, but he says the states need to lift their game.
The situation is eroding. It really needs serious action at state level.
I would like to think and certainly reassure people across the state that we're very serious about reform.
State and territory governments point to various programs and investments they're making to address the problem. And the New South Wales Mental Health Minister Kevin Humphries believes there's goodwill and consensus between the states and the Commonwealth on national reform. But he says change takes time.
Things are starting to turn around now, I believe, but in terms of wider systemic change, we're a few years away from that.
One of the lucky ones to get help, Matt Giles is now returning to the real world, determined to resist the lure of drugs and drink for the sake of his young son.
I feel amazing. I can't wait to get my life back on track. For my son to know me, to call me Dad, and to recognise me every time we see each other.
That report from Natasha Johnson, and that's the program for tonight. If you're fascinated by the phone hacking scandal in the UK, stick with us now for Foreign Correspondent. It's taking a closer look at what's become the biggest crisis in Rupert Murdoch's long career. We'll be back at the same time tomorrow, but for now, good night.